a child falls, cries briefly, and soon seems fine. Days turn into weeks, life moves on, until a parent notices a soft swelling on the child's head, slowly getting bigger. What looks harmless could be a rare but important condition known as a growing skull fracture. Today we break down what this condition is, how to recognize it early, and why it matters to everyone, from parents to medical students to neurosurgical trainees. What is a growing skull fracture? In very young children, especially those under 3, the skull is thin, flexible, and rapidly expanding. After a head injury, most skull fractures heal normally, but in about 0.05 to 0.1% of cases, healing does not occur. Instead, the fracture gradually widens with time. The reason is simple but serious. At the moment of injury, the fracture may be accompanied by a tear in the dura mater, the protective membrane around the brain. This tear creates a pathway through which brain tissue or cerebrospinal fluid can press outward. With every heartbeat or cry, pressure pushes against the fracture edges. The skull cannot keep up, and the defect enlarges. This phenomenon is what clinicians call a growing skull fracture. What signs should the public be aware of? Parents or caregivers often notice a soft, painless swelling on the site of a previous injury, a swelling that gets larger over weeks or months, a mass that may pulsate or become prominent when the child cries, no obvious pain, which may delay concern. Because these signs are subtle, awareness is essential. What should undergraduate trainees look for? Key clinical clues include 1. A history of head trauma in infancy, a skull fracture on initial CT scan, progressive widening of the fracture line, a subgaleal swelling or CSF leakage, and neurological symptoms if diagnosis is delayed, such as seizures, weakness, or speech palsy. Early recognition is vital for preventing long-term damage. A recent 2024 study in Nature introduced a practical 4-type system based on symptoms and imaging. Type 1 is the early stage, which is a linear fracture with a subscalp collection and minimal herniation. The best outcomes happen when treated early. Type 2 is a developing stage. The fracture widens to more than 4 millimeters, a fluctuant swelling appears, with mild herniation or subdural effusion may occur. Type 3, which is a progressive stage, which is clear herniation of brain tissue or CSF through the defect, and neurologic symptoms such as seizures or weakness may develop. And Type 4, which is the chronic stage. In this, you have an established skull defect with bone erosion and brain scarring, often associated with permanent neurologic deficits. This classification may help clinicians align the patient's stage with the urgency of surgical planning. Why does early diagnosis matter? The key issue is the torn dura. If unprepared, the brain continues herniating outward. The skull defect enlarges. Seizures and neurologic deficits may develop. Long-term developmental problems may occur. Treatment involves surgical repair of the dura, known as duroplasty, and reconstruction of the skull. When performed early, outcomes are excellent. Children often recover fully, but delay, however, may lead to complications that cannot be reversed. What should the public, students, and clinicians remember? For the public, any swelling after a child's head injury, especially if it grows, deserves medical attention. For undergraduates, growing skull fractures is rare, but a high-yield differential in infants with persistent widening or swelling of skull defects. For postgraduate trainees, think of growing skull fractures in every case of infant skull fractures with delayed pulsatile swelling, fracture diastasis of more than 4 millimeters, a persistent subgaleal collection, and neurologic decline weeks after injury. Early imaging and early dural repair changes outcomes dramatically. So, growing skull fractures is uncommon, but its consequences can be significant if missed. By increasing awareness among parents, frontline healthcare workers, medical students, and neurosurgical teams, we can ensure children receive timely diagnosis and the best chance at full recovery. Early recognition is not just medical knowledge, it's a life-changing intervention. Thank you for listening and have a blessed day.